Hi guys and welcome to Biz Consumer YouTube channel. Today we are going to have a video interview with a person who in January of this year posted a review on our website about an organization called Loyola Medical. We are looking forward to receiving your comments. Please share your thoughts with us and stay tuned for more videos.
Okay, I'll try to make some of this very short. Late 2016, I started having balancing issues, and I took an MRI, and they detected an acoustic neuroma, which is a brain tumor that grows out of your ear, but is not malignant. So,
Okay.
The short story: on February 14th, 2017, I'm sorry, I walked into Loyola for the surgery to remove it, and it was done by two surgeons. These were highly recommended surgeons, and apparently after 8 hours, the surgery did go well. And except unknowns to me, I was getting some AFib and blood clots, so they put an IV filter in, and they gave me a lot of blood thinner. Apparently not over the limit, but it was very much in a high end. And I was in there for several days with a bunch of arrogant, non-narcissistic type residents, but who were doing the blood thinner. But then I was released on February 24th. 2017, 10 days later, and with a bleeding catheter, and was told I had a urinary infection. And then I saw my urologist on Monday. This is Friday, so I saw him on Monday, the 27th, and he said, "No, you don't." During the weekend, I was having bloody noses, and I was having eye problems, and then my wife on Monday morning called a nurse who I will remain unnamed, but I know who she is, saying that I had some issues, double vision and so forth. And the nurse very arrogantly said, "Oh, if you're having that, go to an eye doctor. That's not for the surgery." So first of all, she should have asked the doctor, not just make that judgment. But then during the day, I went to have some checkups and so forth at a hospital, and they of course I got sick in there, and then that night when I came home, my wife went to get some more medication, and I had blood all over the floor and from a bloody nose, and then my wife, she tried to wake me, and I couldn't wake it. Apparently I was somehow out. I had, it's like I went to sleep, but she could not wake me. And then she called 911, of course, and then I was transported to actually first Edwards Hospital, but then Loyola Hospital, and they should have gave me a CT scan on the way out, and they would have found this. I had a brain bleed is what happened. I mean, which is a pretty serious thing. And one of the doctors told her that they overcompensated with blood thinner, and this is a result. And of course, I was in a coma for 3 weeks. And when I woke up, I couldn't walk anymore. I woke up in a therapy center, and I thought I was in a bad dream or something. But I woke up, and then. That was my first memory after the coma, and then after that, of course, they just sort of just said, "Oop, we got him out of here alive." It's kind of like they just dismissed me, and I wrote several letters to them, and they're only what they said is, "Well, we're sorry you had a bad experience. We'll have a meeting." And of course, they wanted me to take a spine test, which my current neurologist said that's nonsense. He said it's actually nerve damage in your legs, and it's caused lymphedema to top it off. And now I got both of those, and again, the doctor, when I met the one surgeon 6 months after, I was in a wheelchair, and I said, I trade the tumor for the wheelchair. He said, don't mix the good with the bad. And that's Loyola Hospital, just nothing but arrogance. And, they take no responsibility. We've had I've had to pay out of pocket for many, many things. Of course, Medicare covers a lot of things, and I'm sure I broke the bank on the whole thing with Medicare, but they should actually make Loyola pay for it. But that's just a personal thing. But anyway, I mean, now, of course, I even talked to a couple of attorneys, and they said, unless you get a smoking gun, nothing you can do. It costs us $50,000 to $100,000 to go in and depose them. And unless there's really something that we can say they did bad, there's nothing we can do. But I think between the blood thinner, which is very much on the high side, not giving me a CT scan, a nurse saying to my wife, you should go to an eye doctor and all that sort of stuff. That it's a sad thing, their attitude. But anyway, I walked in there and I was carried out. I walked in there. I even actually walked after the surgery, but that blood thinner got me so bad that I ended up in a coma. And then now, of course, I'm in a wheelchair. I can walk on a walker, and I've got lymphedema to top it off. So the short story is, I would say to anyone, I'm not bashing the surgeons, but I am Loyola Hospital and the surgeons, because they didn't follow up with me and never saw me after the surgery, except the one 6 months after that told me, don't mix the good with the bad. But I would recommend anybody to stay out of Loyola. I'm not saying the surgeons are bad, but the hospital's bad. It's like a 1950s movie when you go in there. I mean, it's a terrible hospital. It's a zoo there, and arrogant, nothing but arrogant people there. When I say arrogant people, I'm talking about the staff for the most part. I also went in. They were told me I'd absolutely have to have that IV filter out in 6 months, and I went there to take it out, and the surgeon said I can't take it out because there's still a blood clot or two around it, and he said you're going to keep it for life. So that was after they told me I absolutely had to have it off 6 months later. So anyway, that's the short story. The long story is I'm in a wheelchair, can walk on a walker. And I'm going for therapy for lymphedema, and boy, you have to buy all kinds of stuff which Medicare doesn't cover. Very expensive, but of course, Loyola takes no responsibility for anything other than to say, we're sorry you had a bad experience. I said, this is like I bought a pizza that went bad. I mean, I'm sorry you had a bad experience. What is that?
Like, what did you try to do to contact Loyola? Did you call them? Did you went there after what happened to you and try to talk to somebody? And what did they tell you in response, if anything?
Well, 6 months after, as I mentioned, I met with one of the surgeons, and he said, don't mix the good with the bad, after I told him I'd like to trade the tumor to be able to walk. Secondly, I wrote him a long, it was probably about a 4-page letter, which I'm using some of here, and outlined everything. And I try to be very specific, very accurate, very and not not any bashing or any bad language. I was very professional. How I contend. Oh, there we go. Lost you there for a minute, but anyway, good question. One of the doctors, I gave him a bad Google review, and he was real mad. He called me up, and he didn't ask me how I was, but he was just chewing me out because I did that. And I had a couple of words for him because he was pretty arrogant and nasty. But anyway, I told him I wasn't going to take it away because I said, you put me in a wheelchair. So, but anyway, he wasn't too happy about that. But other than that, I mean, I wrote him a letter back. I wrote probably all of 3 letters. Somebody called me up, and it was somebody that, that was hired to do that sort of stuff. They really had no, and there was, I mean, they just took no responsibility for this. They just acted like, well, okay, too bad you had a bad experience. That's it. So to answer that question, I spoke to both the surgeons and some other people within the hospital that were, patient people that placated patients, basically, is what they really were. But they're one of these people that couldn't possibly do anything for you. Just talk to you and tell you they're sorry you had a bad experience. They'll have a meeting. That's it. That was their. And even a letter I got back from them at one time pretty much said the same thing. And they'll review all their policies. That was, and of course the day after the surgery, all as they were worried about is if I had a bowel movement. And I mean that they never said anything about the blood thinner, blood clots to me. I mean, I knew all this. After the fact, and when I really realized what really happened. But anyway, there we go. But any other questions?
Did you have a choice to go to another hospital and use other hospital services, not Loyola's, at that time?
I could have maybe went to the Mayo Clinic. It was a pretty. Apparently there was very few people that were competent, and these were two surgeons that were well known for doing this surgery. But to answer your question, locally, not really. Probably a Mayo would be the next choice if I had one. And that was in Minnesota. So
what if this organization, the Loyola Medical, could do something right now to remedy a situation? What if they could do something for you?
Well, there isn't much that they could do. Actually, if I would have died in the hospital, that would have made me happier. But there isn't really much they can do because there's nothing. My neurologist said there's just nothing you can do about this. And it's a lifetime. He said, unless you have a miracle, and he said, only one makes miracles. He said, it's a lifetime thing. But what they could do now, which still wouldn't make me that happy, but it would be nice if they would pay for some of the out-of-pocket expenses, like the garments that are required for lymphedema, very expensive, and they only last a year anyway. But lymphedema is not a something they can treat. It's all you can do. I mean, they can treat it, but there's nothing they can do to get rid of it. It's you just, what you have to do is do maintenance to work with it, but there's no way to get rid of it. It's just that and the nerve damage are two things. So to answer that question, I don't know that there's anything they can do to make me happy, but they could at least take some financial responsibility for what Medicare doesn't pay.
Why did you decide to go public with this? Why did you decide to go on the internet and expose the situation that you had or you have been having with Loyola Medical?
Because of their attitude and they're not taking any responsibility for it other than to say, sorry, that you had a bad experience. I mean, they've taken not even an apology, nobody's even called me up to ask me how I am. Very, nothing positive about their reaction to this. And, again, there's a lot of out-of-pocket expenses. I'm on Social Security, and these are some very expensive items that you need for, plus the therapy. And of course, Medicare pays for a lot of the therapy, but I had to stop because, Medicare pays for so much, and then they stop you after about 20 thing. And that would at least, it's helped me do some things, based on the condition I'm in. So that's why I decided to go on the internet.